Did you know that how your regenerative injection is delivered can be just as important as what's inside it? One of the hallmarks of regenerative therapies is being able to place those biologics exactly where they're needed. So, the big rub for chronic joint pain is that there are certain tissues that just don't have access to the body's healing ability, or there are areas of the body that just can't overcome the injury on their own. So as you can imagine, delivering, biologics in abundance directly to where the injury is paramount to the overall success. When we're dealing with a complex joint, let's use a shoulder, for example. Pain can come from many different places in the joint. It can come from a rotator cuff tendon. It can come from the joint capsule itself, the labrum. It can come from many different structures. So understanding where the injury is and then being able to deliver those biologics exactly into the injury so that you can create a healing process and help that individual overcome that problem is absolutely essential in the regenerative medicine space. Using image guidance is the only way to really know where you're going to place those biologics so that you can effectively treat the damage or the condition itself. For example, like let's say with a knee, there's two primary joint compartments, there's a patella that you have to get underneath, but at the end of the day, if you're not using ultrasound guidance so that you can visualize the joint space, there's actually fat pads in the knee joint itself, and sometimes you don't get through that fat pad in order to get into the internal joint space and affect the structures that are actually injured. We have access to both ultrasound and video fluoroscopy. One is a little more advanced than the other. Ultrasound is typically used for peripheral joints, most commonly, and fluoroscopy is used for spine complaints, right? So as you can imagine, it's twofold. You want to be able to place biologics exactly where they're needed so you have the effectiveness of the procedure, or you have the best possible outcome for that individual. But more importantly, you want it to be a safe environment. You want to know where the needle is at all times so that you don't put needles into sensitive structures. It's also for patient comfort, right? So, when you're injecting a joint blindly, you don't want to put that needle in too far and ultimately end up, placing the needle into something that is really pain sensitive. You want to get it as close to the damaged tissue as possible so that you have the best outcome that you can for that individual. You want it to be comfortable and you want it to be safe. It's really very straightforward. There's an art and science to all disciplines in medicine, and regenerative medicine is no different. So when we talk about like gold standard approaches, these are approaches that are well established, that are evidence-based, that we have algorithms for specific conditions. So having a deep understanding of the condition first is really important, and then understanding also what tools and resources would be appropriate for healing that particular condition, let's say. And there are many target tissues, and having multiple resources at your disposal just allows you to provide more complete care and do it in a way where we can monitor and track clinical outcomes. Right? So when we say gold standard, obviously with biologics, with regenerative medicine, precise placement is a hallmark. It's absolutely essential. But then also having the clinical experience and the outcome measures necessary to track progress is just as important as, selecting patients on the front end when you're making decisions about, high likelihood for success or not. With that, we also want to be, evidence-based. We want to know exactly where the literature and the research tells us that we're going to have an effect based on the types of products and resources that we're using. Having the right processes and protocols are absolutely essential for providing good care. You want it to be reproducible. You want to produce the very best outcome possible. So we have very specific protocols in place, from how we harvest to how we process to how we deliver, so that there's some standardization and we can ultimately get the best outcome possible. Now, obviously with that, we want a wide variety of tools because we can't have a myopic view of conditions. If somebody presents with a very specific, finding, it's not just about that particular tissue. It's about the global approach to healing the entire joint, and taking a holistic approach to their overall health is absolutely essential. But then being able to track the results very precisely, like with a registry, so that we understand that with the protocols and the algorithms that we use, what type of result does it achieve in that particular individual? And then we can kind of get better information on how to treat people into the future. Before you consider a regenerative therapy, be sure to ask about image guidance. It's one of the most important steps to better results. And if you have any questions, you can leave them in the comments. I'm happy to explain. And if you know somebody who's considering regenerative medicine, please share this video with them.